Hey everybody, it's me again. Just want to check in with you all. We are super excited about the vaccine rollout. So many people have already received their first dose. A lot of us have already received our second dose. We have about 65% of our active employees vaccinated so far, so really good numbers there. But we do need to make sure that we are all getting vaccinated as soon as we can. And I realize that some of you are not able to get the vaccine because maybe you're not in a community that's offering it, or you haven't been able to get to one of the registration sites for the city of Chicago. Please be patient. We will let you know as soon as possible when we get more dates for that. If you are working in a community like the Brookdales or Three Crowns Park, those are communities that are still giving the vaccine. And it's very important that you go ahead and get yourself registered for the vaccine. If you are not feeling comfortable yet, I strongly encourage you to reach out to me so that we can have some conversation about maybe why you're not there yet. And for many of you that I've spoken with, you've said that you think you're going to get it. You just, you're a little bit of cold feet, which I understand, but, going forward, our communities, our seniors, they want to have people working with them that are vaccinated. If my choice is to have somebody in my space that is vaccinated or is not, I'm going to take the is vaccinated person all day long. So eventually it will be mandatory. So it's really important that you make your decision so we can help you get vaccinated as soon as possible. Some of you have asked if you still need to get tested. Yes. As far as we know of the vaccines we are receiving now, the Pfizer and the Moderna, it's about 95, 97% efficacy, which means that that's how much we're protected from the virus. So that little percentage that's left over, we could be carrying it still. So we really still need to wear our masks and all our PPE appropriate for our clients' care. And also, if I started walking down the street and I didn't have my mask on, I think people would really freak out. So right now, we all still need to be maintaining our social distance, staying 6 feet, washing our hands, washing our clients' hands, and getting and wearing our masks at all times. The other thing I want to mention is that many of our clients are getting vaccinated as well. In the communities themselves, we're seeing over 90% vaccination, which is amazing. So that tells you that they want to get vaccinated. They want to be surrounded by people who are vaccinated so that they can be with their loved ones and family and friends. And so we have to do our due diligence and be as safe as possible for them and for ourselves and our families. So, and as more dates come up with the city, we will absolutely let you know. I can't stress enough though, once you see that email, please, please, please call us and we'll help you get registered. Those dates go very quickly. And now that 1B has rolled out, which is other frontline workers, firefighters, paramedics, they all are able to get the vaccine now. So there's quite a bit of a rush to get the vaccine. So please, as soon as possible, let us know so we can help you get registered for that. More vaccines are on their way. I know Johnson & Johnson is going to be rolling out theirs soon. I think as I've heard a lot of doctors say, whatever vaccine you can get, you should get, because it's better than nothing. Okay, so which leads me to another question that I was asked recently, which is, what about all the variants of COVID? The ones from the UK and South Africa. Again, I think that being vaccinated and at least having this vaccination against the current COVID is just helps us so much more. I know that it does help against the UK, the one from London. And I don't know how much percentage of the other ones, of obviously those they're going to be testing and trying to figure that out. I wouldn't be surprised if there was some kind of booster or another vaccine for those. You know, we just need to stay on top of watching, you know, the scientists that are talking about the vaccine, that know what they're talking about. And you know what? It doesn't hurt to also talk to your doctor. If you are concerned, you have questions, you have allergies, call your doctor. Talk to somebody who understands the science behind the vaccines and understands and has studied medicine their whole life. So, which brings me to one of my last little points I want to make. I have a lot of people who I talk to that say, oh, I heard this and I saw this. And I just want to say that it's really important you understand where you get your information from. If it's from your kids or a cousin who is, you know, a baker, they might not be the best people to get your medical information from. There's a post that we've just put up that Arnold Schwarzenegger put out, and I loved it. You know, he talks about how you don't, if you have a question about bodybuilding, you go to Arnold Schwarzenegger because he's one of the best bodybuilders in the world ever. He studied it his whole life. You could ask him anything. He knows it, right? If you have a fire at your house, you're not calling your best friend on Facebook, or you're not posting it on Instagram to ask them what to do. You're actually going to call the fire department because they've studied how to put out the fire. Same thing goes with, you know, if you're having chest pain at home, you are, you're not going to ask your other Facebook group what to do. I don't mean to laugh, but it just seems silly that we're not getting our advice and information from people who have studied this vaccine. They've studied medicine, they've studied the human body their whole lives. And I've also heard from people too, they're nervous because it's something that has come out so quickly. The science behind vaccines has been around a really long time. If you've never heard of polio, go ahead and look it up. It's been eradicated because of a vaccine. There's a lot of other vaccines that you've taken as children that you fortunately never got. You never got the measles, you never got, you know, chicken pox. Well, I did, but anyway, you know what I mean. It's the vaccines are an amazing scientific technology. We wouldn't be here today without a lot of the vaccines and a lot of the science behind them. So please get your information from good sources. If you need to ask me for some of the sources, I'm happy to share those with you. So call me if you have any questions, or contact your care manager. I'm happy to sit down and do some one-on-one if you've got more questions or concerns. And I hopefully will see all of you get vaccinated very, very soon. So thank you for your time and take care.